Imagine your body sending you warning signals and you not even realizing it. Today we're uncovering the silent whispers of diabetes, including both type 1 and type 2 diabetes. We'll dive into the top 10 subtle signs of diabetes that often go unnoticed. From unusual thirst to unexpected weight changes, we're exploring each sign backed by scientific research. Stick around until the end because recognizing these signs early could not only change your life, but potentially save it. Number 10. Unexpected weight loss. When someone has diabetes, their body can't use sugar from food in the way it should. This happens because the body either doesn't make enough insulin, a hormone that helps sugar enter cells, or can't use insulin properly. Without insulin doing its job, sugar stays in the blood instead of being used by the cells for energy. To find energy elsewhere, the body starts breaking down fat and muscle, leading to unexpected weight loss. This kind of weight loss is often one of the first signs that something is wrong. Studies have shown that those newly diagnosed with diabetes often report having lost weight without trying in the months leading up to their diagnosis. Number 9. Increased thirst and urination. The reason people with diabetes feel thirsty all the time and need to urinate more often is directly linked to the high levels of sugar in their blood. When there's too much sugar in the blood, the kidneys work harder to filter and absorb it. If the kidneys can't keep up, the excess sugar is excreted into the urine, dragging fluids from the tissues along with it. This process makes people pee more, which then makes them thirsty because they're losing fluids so quickly. Research has documented that these symptoms are among the earliest signs of diabetes, often leading to a diagnosis. Number 8. Increased hunger. The feeling of being hungrier than usual even after eating is another sign of diabetes. This happens because the body's cells aren't getting the sugar they need for energy. So, despite eating, the sugar from the food can't enter the cells without insulin working properly. The body thinks it's not getting enough food and signals for more, causing an increase in hunger. Human studies have explored this phenomenon, showing that people with untreated diabetes often experience a significant increase in hunger because, from the body's perspective, it's in a state of starvation, even if the person is eating regularly. Number 7. Fatigue. Fatigue is a common complaint among individuals with diabetes, characterized by an overwhelming sense of tiredness or exhaustion that isn't relieved by rest. This fatigue results from the body's inability to properly use glucose, a type of sugar, for energy. When insulin levels are insufficient or ineffective, glucose remains in the bloodstream instead of being transported into cells to be used as fuel. Consequently, the body lacks the energy it needs to function optimally, leading to feelings of fatigue. Research involving people with diabetes consistently shows a strong correlation between uncontrolled blood sugar levels and increased fatigue. These studies suggest that managing blood sugar levels effectively can significantly reduce the severity of fatigue in individuals with diabetes. Number 6. Blurred vision. Blurred vision in individuals with diabetes is often caused by high blood sugar, which leads to changes in the fluid levels inside the eyes, affecting the lens's ability to focus properly. Over time, if blood sugar levels remain high, this can cause damage to the blood vessels in the retina, the part of the eye that senses light, leading to diabetic retinopathy, a condition that can cause vision impairment. Studies have documented that early detection and control of blood sugar levels can minimize the risk of developing serious eye problems and help reverse vision changes, emphasizing the importance of regular eye checkups for individuals with diabetes. Number 5. Slow healing of cuts and wounds. Diabetes can impair the body's ability to heal cuts and wounds efficiently. High blood sugar levels can damage nerves and blood vessels, reducing blood flow to certain areas of the body. This decreased blood flow means that less oxygen and fewer nutrients reach wound, slowing the healing process. Additionally, high sugar levels can weaken the immune system, making it harder for the body to fight off infections that can occur in open wounds. Research has shown that individuals with diabetes experience longer healing times for wounds, particularly those on the feet, and emphasizes the importance of careful wound management and blood sugar control to prevent complications. Number 4. Tingling, pain, or numbness in hands or feet, neuropathy. Diabetic neuropathy is a form of nerve damage that can occur in people with diabetes. This condition is primarily caused by prolonged periods of high blood sugar levels, which can harm the walls of the tiny blood vessels that supply nutrients and oxygen to the nerves, particularly those in the legs. The initial symptoms of diabetic neuropathy often include tingling, pain, or numbness in the extremities, starting at the tips of the toes or fingers and potentially progressing upwards. These sensations can range from mild discomfort to severe pain, significantly affecting the quality of life. Research has consistently shown that maintaining controlled blood sugar levels is crucial in preventing the onset of diabetic neuropathy. For those already experiencing symptoms, effective blood sugar management can slow the progression of the condition and may alleviate symptoms. Lifestyle changes such as healthy diet, regular exercise, and smoking cessation alongside diabetes management plans are essential strategies in managing neuropathy. Number 3. Dark skin patches. Acanthosis nigricans. Acanthosis nigricans is another condition often linked to diabetes, characterized by the appearance of dark, velvety patches on the skin, particularly in body folds and creases such as the neck, armpits, and groin. This skin change is closely associated with insulin resistance, a condition where the body's cells become less responsive to insulin, leading to elevated insulin levels. High insulin levels can stimulate the rapid reproduction of skin cells, resulting in the characteristic dark patches of acanthosis nigricans. The presence of these dark skin patches is a visible marker of insulin resistance and can serve as an early warning sign of the potential development of diabetes, especially in individuals in a pre-diabetic state. Studies have indicated a higher prevalence of acanthosis nigricans among patients with diabetes or those at risk, underscoring its significance as an indicator of altered insulin levels. Both diabetic neuropathy and acanthosis nigricans highlight the systemic nature of diabetes and its potential to affect various body systems. Recognizing these conditions as part of the broader spectrum of diabetes symptoms emphasizes the importance of comprehensive diabetes management. This includes regular monitoring of blood sugar levels, adherence to treatment plans, and lifestyle modifications aimed at reducing the risk of complications. Through proactive management and awareness of these conditions, individuals with diabetes can take significant steps towards maintaining their health and prevent further complications. Number 2. Frequent infections. One of the more concerning aspects of diabetes management is the heightened risk of infections. High blood sugar levels can impair the immune system's ability to function correctly, making it less efficient at fighting off bacteria, viruses, and other pathogens. This impairment can lead to a variety of infections, with skin infections, urinary tract infections, and yeast infections being particularly common among individuals with diabetes. The reason behind this increased risk is twofold. Firstly, elevated glucose levels in the blood and tissues create an environment where pathogens can thrive and multiply more easily. Secondly, the immune system's compromised state means it cannot respond as swiftly or effectively as it should to invading organisms. Scientific research supports these observations, indicating that the immune response in individuals with diabetes is altered, leading to slower and less effective healing and infection control. This body of evidence underscores the critical importance of maintaining controlled blood sugar levels, not only to manage diabetes, but also to bolster the immune system's defenses against infections. Number 1. Mood changes. Research has consistently shown that people with diabetes are at a higher risk of experiencing mood disorders than those without the condition. These mood changes are directly influenced by fluctuations in blood sugar levels. Such fluctuations can affect the brain's chemistry and function, leading to mood swings and other psychological symptoms. The interconnection between blood sugar levels and mental health emphasizes the need for a holistic approach to diabetes care. Comprehensive management plans that include mental health support can often address the psychological aspects of living with diabetes, improving overall quality of life for those affected. That's all for today, Thriving Beings. Today we've navigated through the 10 silent signs of diabetes. From the unexpected to the commonly overlooked, recognizing these early can lead to timely intervention and management. Knowing these signs is the first step towards taking control of your health. To prevent more serious conditions from developing, be sure to listen closely to the signals that your body is giving you that are alerting you that your health might need some extra care and attention. Thanks for watching.